Okay, so this is the second lecture of the chapter 1 of veterinary general pathology, JL Vegad. Okay, so yesterday I said that I didn't need the meaning of exudate, so here is the meaning of exudate. Exudate, the mass of cells and fluid that has seeped out of blood vessels or an organ, especially in inflammation. So that is called exudates. Okay, definition from the Google. Okay. Definition from Google. Okay. So now let us move on to the branches of pathology. First is macroscopic or gross pathology. It is the examination of tissue without the help of microscope or with the naked eye. Microscopic pathology or histopathology, examination of tissue with the help of a microscope and involves the use of stained tissue sections. Microscopic pathology or histopathology is that branch of pathology in which we use microscope and the stained tissue sections for understanding the pathology of any particular piece of tissue. Okay. Next is chemical pathology. This is study of chemical alteration of the body fluid and tissue that result from the disease. That means when the disease progresses in a tissue, then or an organ, then body fluids and tissue their chemical nature become altered or changed. So that is that studying that changes in the chemical nature, that is called chemical pathology. Next is post-mortem pathology, pathology. So post-mortem examination is the examination of an animal after death to establish the cause of its death. Okay, post-mortem is a very common word. So post-mortem examination is examination of an animal after death to establish a disease cause of the death of that animal. Okay, now post-mortem of human is called autopsy and post-mortem of animal and bird is called necropsy. So that is written on the next page. So here so examination of animal body is called necropsy and term autopsy is for post-mortem examination of humans. Now there is one term which is called morbid changes. So morbid changes are the alterations found in tissues at necropsy as a result of disease. So any type of tissue which is found in that any type of change which is found in the tissues during necropsy which took place because of the disease is called morbid changes. Okay. Next term is biopsy. So biopsy is examination of the tissue removed from living living animal to determine the cause of disease. Simple. And example is we do it in a suspected cancer and we do it in case of celiac disease in humans, etc. Okay. Now one term is there which is called syndrome. So syndrome in literal meaning is the group of symptoms. Okay, group of symptoms that occur together and are a characteristic of certain disease. That is called a syndrome. Okay. Okay. Next example, for example, example of syndrome is AIDS. So AIDS, the full form is acquired immunodeficiency syndrome. So it means that any immune system deficiency symptoms which are acquired, group of immune system deficiency symptom acquired during the lifetime of a human, that is actually AIDS. Okay, so this is an example of syndrome. Now health and disease. So health is the condition in which the individual is in complete harmony with its environment and surroundings or surrounding. So health, the human is in ease and is in the complete harmony of its environment, with its environment or surrounding. And disease, disease means dis and ease. So it is any condition in which the animal or human is in discomfort. Is that condition is the animal or human is in discomfort. Okay. Okay. So next there is one term given here, compensatory hypertrophy. So what is compensatory hypertrophy? See, the concept of here it is written there, the concept of pathology for the concept of disease for a pathologist and clinician is different. Okay, the concept of disease for a pathologist and a clinician are different. For example, the example is compensatory hypertrophy as shown by kidney. Okay, so what will happen if an animal or dog one kidney is not working, then we remove that kidney, so the dog will live a normal life where the second kidney will become twice its size. That is called hypertrophy, increase in size, that is called hypertrophy, and cell size hypertrophy, and that will increase in its size, and that will cause the second kidney will get twice of its size, become twice of its size, and that will help it to perform the functions of the lost kidney also. So clinically he is not not in disease condition, or pathologically he is in a disease condition. Okay, so because why pathologically? Because the absence of a kidney is a structural deviation from the normal. So anatomy is deviated and study of anatomy in not disease condition or deviation is called pathology. Okay. Next is genus. So these are the factors which affect the various types of animal, different types of animal and different type of diseases takes place because of these factors. So second is genus. Now genus, swine fever is a disease of pig, easy, and no other animals are affected with it. Then canine distemper is a disease of dog. Okay. Breed, dairy cattle are much more susceptible to diseases than beef cattle. Okay, easy. And brain tumors are more common in bulldog and boxer as compared to other breeds of dog. Strain. Now some animal strains of animal possesses certain characteristics with the help of which they show higher resistance to certain diseases, some of the animals, and strains which are created. So for example, strain of chicken that have unusual resistance to leukosis can be produced, in contrast to other strains which have very high mortality rate from this disease. Okay. Other examples include hernias in pig and calves by hydrocephalus. What is hydrocephalus? Accumulation of fluid in the ventricles of brain. Okay. Okay. Next is age. So tumors are commonly observed in older animals. Strangles is a disease of young horses, and cecal coccidiosis in the chicken is a disease of young birds. Okay. We don't have to study a disease here, we just have to learn the examples here. Okay. In this chapter. Now, sex. Reproductive diseases are more common in the female than in the male. Okay, easy, because their reproductive system is much more complex and and serves much more functions than as compared to the reproductive system of male. Okay, so mastitis, milk fever are confined to female, and nephritis in the dog is 2 to 3 times more common in the male than in the female. In the cattle, nephritis is more common in the female. Okay. Okay. Now color. So cancer melanosarcomas are very common in grey and white horses. Why? And very rare in black and brown horses, because black or brown horses have pigment on their cells. So pigment prevent the radiation from entering or penetrating the skin. Okay, thus inhibiting the chemical reaction. Okay. So this is all about chapter 1. Thank you.